STEAM Series, championed by your Southern California Toyota dealers.
Each week, we are bringing you the story of someone who has an amazing career because of a background in one of the STEAM disciplines. Today, we're focused on science.
Doctors sign up for this moment. It's a moment when we have an opportunity to help people.
ER Dr. Mark Morocco works to save lives in the emergency department of Ronald Reagan UCLA Medical Center. In 25 years practicing medicine, he's seen it all.
But this is a unique, sort of unprecedented experience, even for doctors.
For the past few weeks, Dr. Morocco has been working outfitted like this, part of the new reality of the COVID-19 pandemic.
It takes a long time to make a critical care doctor. And so first, I have to protect myself so I can protect you.
Dr. Morocco spends about 30 minutes at the start of his shift suiting up, and another 30 at the end getting it all off.
The most dangerous time for healthcare providers and for doctors, and this is a lesson from Ebola, was when people take off their equipment.
Once home, these days, a second decontamination ritual.
I'll walk through the gate and go directly to the shower.
An open-air shower in the backyard.
And I take everything off, from my clogs, all of my clothes that are relatively clean.
He drenches them completely in steaming water. Then it's his turn.
And I'll do a regular head-to-toe shampoo and soap shower. Before I get out of the shower, grab up everything that got wet, throw it back in the plastic bag, and then wash my hands one more time.
A sealed plastic tub holds an untouched towel, shoes, and set of clothes. Final stop?
The laundry we have in the garage.
He drops in his travel scrubs.
Wash my hands and arms again, then I feel comfortable to go into the house.
He says all the extra precautions are worth it, so he remains healthy enough to save lives. Dr. Morocco came to medicine later than most. He spent his 20s working in theater, and then
I was nearly killed in a car accident. My life was saved by an emergency room and trauma surgeon and a hospital that was ready.
he found his calling.
I went to medical school when I was 30.
And once he graduated,
I chose emergency medicine because of my experience.
of all the STEAM disciplines, Dr. Morocco relies most on science and art.
And the art of medicine that allows people to bridge the great research with the human aspect of people who come to the ER every day having a terrible day, sometimes the worst days of their life. The way that you interact with patients can have a huge impact on how confident they are in their health care, how willing they are to follow your directions.
More than 3,000 frontline healthcare workers have contracted COVID-19 across the globe, and the numbers are rising.
We've already had lots of physicians and healthcare workers, some nurses, who have died from this disease. So it's not lost on me that there's risk, but a lot of people take risks.
Why do it anyway?
I like people, I like stories. If you want to be an important part of a day in their life, emergency medicine is the best place in medicine.